Hello, doctors. Well, today we're going to talk about this sign and symptoms of childhood cancer, which is going to be a guide for early recognition. And this is because last February the 15th, we celebrate the International Day for Childhood Cancer. And just is to remind that those cancers that are presented in children, adolescents, and young adults, we know that so far we can be treating them very effectively, but the condition should be if we have an early detection, an accurate diagnosis, and of course the quality of the treatment services. Okay, so let's take a look about these signs and symptoms of childhood cancer. Just to remember, this is although we know that cancer in children is not like really common, we must consider that this is the second most common cause of childhood mortality in developed countries. Okay, as we can see, we have very different kinds of cancer, and the one that we can notice that is the most common will be leukemia. But we might be thinking about all others cancers that involve the brain or soft tissue or kidneys, the bone and joints, and those ones that also are affecting the eye. Something that is very important about this childhood cancer is that most of the times we will have no non-specific symptoms that may be similar to those benign conditions. So that's why it's a big challenge, because we had to be very acquisitive to look for this diagnosis, so we do not delay these treatments for these children. For us as a primary care physician, we must be thinking about this suspicious of those possibilities in these children who may be suffering for cancer, and will be also looking for those persisting signs and symptoms. As an early diagnosis for this childhood cancer, we must be identifying those early signs, and just as we said, being very aquarius and being always thinking about the possibilities. We know we have like several signs and symptoms, going from headache, lungs, bruising, upset stomach, sweating, squeam, discharge, early puberty, stiffness, all these conditions that may be telling us, like in a very early stages, that we are facing childhood cancer. We also know that in the recent years, of course, the all these achievements in those investigations, researches are giving us more advances, and the treatment for this childhood cancer is giving them very higher survival rates. We are using like these complex therapeutic procedures, and the thing is, as soon as we detect our cancer, then we are going to start sending our children to the specific specialist, so they can start a treatment in advance, and then they should be using those technical resources, and then using those personal, like, who are really trained, like those pediatric oncohematology doctors. We must also be aware that even though this it's affecting all children and adolescents around the world, we are also having a lot of patients that are diagnosed in Latin America. And as we know, in America, we have about 32,065 new cases in 2020, and most of them will be localized in Latin America and the Caribbean sites. Uh, Something that is very important is that most of these children that has cancer will be living in those low and middle income countries, where we are facing not only or we are not only fearing about this cancer, but also those unacceptable inequities in these countries, where this early detection, the diagnosis, and the access to the quality treatment and palliative care are really, really very difficult or low. As we know, these children that are living in a country with inferior outcomes, we have those threatening to social cohesion, the economic prosperity, and those things that we are trying to achieve in those global targets that are included in the 2030 agenda for this sustainable development. So, as we can see in the numbers, 80% of children with cancer will survive if we are in those developed countries, against that only 20% of children that will survive when we are talking about those countries that are that have this lower middle income. Okay. So, as I told you at the beginning, we celebrate this February the 15th, the International Day of Childhood Cancer. And, well, we are looking for tools that help us uh, to look for those signs and symptoms in an early stages, so we can offer a better prognosis to these children. So this is one of the pictures that we use in the health centers and the salubridad to teach our mothers or the population in general, so they can be aware of what signs of alarm can uh, consider if they have a child with some uh, sickness. And we'll talk to you about this Grace story. This is Grace Kelly Lady Bird Trust or Legacy. It talks about a little girl whose name was Grace. She was born on the July 2010, and 9th of July. He was a petite and very caring little girl who loved to run, climb, and be active. But the September 2014, he started school and was so happy to go to school, so small but proud to be in her new uniform. After that, few weeks into term, Grace became very sick or suddenly unwell, and he has to. She was taken to the hospital, and after some laboratory tests and CT scans and else, she was found to have a renal malignant rhabdoid tumor. She rapidly deteriorated, and this perfect girl that was only 4 years old passed away on 8th of November 2014, surrounded by her family. Out of this devastation, Grace wished to help others, that has grown into an inspiring legacy that nowadays is helping save the lives of children who are diagnosed with cancer. And, well, this is what she taught us, the signs and symptoms, which is using a mnemotechnique, which says, Lady Bears, when we are thinking about the possibility of cancer in children. And as we know, if we know that our child has one of these symptoms, maybe you should be worried about them, and we should be taking to a review or a follow up with the doctor. And most of the time, these symptoms maybe not be cancer, but if it is a cancer, however, an early diagnosis can save the life of these children. Okay, we might go in from loss of weight, appearance, if our child is looking pale or has any swollen tummy, if he's discomforting, like any pain anywhere, if we are concerned because it's we are thinking it might not be a regular situation. If we have bleeding, we know about those children are really easy to have bruises because they play, they climb. But if those bruises are happening like very easily or in a constant situation, that could not be totally normal. if we have blood in the urine, if we have swelling or lump that is persistent, any disturbance in vision, a new squint, means crossing eyes, headaches, constant headaches, or any unusual white appearance of the pupils in those photographs, or if we have recurrent high temperatures or night sweats, and if our child is constantly irritable or has constant exhaustion. So all these signs and symptoms can lead us to the diagnose, an early diagnose for this cancer of childhood. Talking about the salubridad, we also use this tool to look for those early signs and symptoms. And we know that these children should be followed up at least twice a year. Some of the signs and symptoms that we look in this tool is about fever, headache, bone pain, bruises, petechia or gum bleedings, and also conjunctival or palmar pallor. We may also be looking for troubles in the vision. If we are going to look for leukocoria, for squint, aniridia, ephema, or even proptosis. And just to remember a little, the most common cancer of children are these all these options. We're talking about leukemia, brain and spinal cord tumors, neuroblastoma, Wilms tumor, lymphoma, which will be including both Hodgkin and no-Hodgkin Hodgkin lymphoma. We may also talk about those rhabdomyosarcomas, retinoblastoma, and those cancers that affects the bones, which are where we include the osteosarcoma and the Ewing sarcoma. As we remember, leukemia, as we saw at the beginning, is the most common cancer in children, and it comes from the blood forming tissues, which includes the bone marrow, the lymphatic system, and of course the white blood cells. We know that these white blood cells help us when we are being sick. They are those protect infection fighters, and they will be growing up normally and dividing into these different kinds of white blood cells as we are requiring them. But those children that will be suffering from leukemia, in these children, the bone marrow will produce an excessive amount of these abnormal white blood cells, which of course will not be functioning properly. Of course, the signs and symptoms of this leukemia will include those fever or chills. If we are having a child with a persistent fatigue, weakness, if this child is suffering from frequent and severe infections, if even though he's not trying, he's losing weight, if we may find some swollen lymph nodes, or if we are touching their abdomen, we may find out some enlarged liver or spleen. If they are having easy bleeding, which is showing some bruises or gums bleeding, or even bleeding from the nose, epistaxis, and if they are presenting those petechia, which are those tiny red spots in the skin. And of course, we know the treatments for this leukemia will be will depend on those kind of leukemia that the child is presenting. Of course, the age will be something a factor that is very important, and if also this leukemia has spread to other organs or tissues. Now, when we talk about leukemia, the red flag signs for this leukemia or lymphoma will include those unexplained and protected pallor, malaise, fever, anorexia, weight loss, lymphadenopathy, hemorrhagic diathesis, and as I told you, the hepatosplenomegaly. Talking about the retinoblastoma, we know that for this cancer, leukocoria will be the red flag. And we know what we call leukocoria. It's the white glow in the eyes that can appear in flash photos for many children. Also, we may be thinking about this poor vision. Okay, we must just remember that retinoblastoma is a cancer that comes from the retina, which is the light sensitive lining at the back of the eye. And we know at the beginning, when these early stages of the baby developments, these eye cells will be growing very quickly, but they should stop growing. But sometimes these cells do not stop growing, and then it's when they form this cancer, which is called the retinoblastoma. Okay, how can we diagnose this retinoblastoma? Sometimes it could be very easy when we take a look of those children, and then we can find out that instead of the normal reflect, we might find this white um, color of the retina. As we can see in this left photograph, we can see with no flash the picture, and then after taking the flash, we can really easily see how different it is. We can figure out that there's something wrong in this eye. We may also will be looking for those children with a squint, which is a crossed eyes. Just remember, we may have esotropias or hypo or hypertrophias, or these outwards, which are exotropias. We may also find this red and painful looking eye, which is also a sign of warning sign, and we may also find ptosis. Now, when we talk about those brain tumors, we may be thinking about those morning headaches, which are associated with vomiting, mainly in the morning, and those neurologic symptoms, or even going down, like the back pain. And we may be thinking about those tumors of the central nervous system. When we talk about the abdomen, we must be thinking about those palpable masses, and or those masses which are palpable in soft tissues. And also, if we're thinking about persistent bone pain, then we may be thinking about those red flags for abdominal soft tissue and bone tumors. When we talk about this tumor, which is the Wilms tumor, we talk about the kidney cancer that is affecting children about 3 to 5 years old. We know this cancer is also known as nephroblastoma, and we might find some swelling or lump in the belly, and maybe also including fever or pain or nausea, or these children that don't want to eat, they have poor appetite. When we talk about the kidneys, we know this nephroblastoma is the most common cancer, and it may happen in only one kidney, but sometimes it may be found in both kidneys at the same time. Talking about the rhabdomyosarcoma, it's a very rare type of cancer. This is formed in the soft tissue, specifically in the skeletal muscle tissue, and sometimes it can be localized in the bladder or uterus. It can be presented at any age, but it is most commonly present in children. When we talk about the Ewing sarcoma, we know this is a peripheral primitive neuroectodermal tumor, and is uh, named like this because it was first described in the for this Dr. James Ewing. About the neuroblastoma, this is a cancer that is developed from the immature nerve cells in several areas of the body. It arises most of the times around the adrenal glands, but it can be also presented in any other area of the abdomen, the chest, the neck, and even near the spine. This is affecting most of the time children about 5 years old, around 5 years old, or even younger. So, what should we do when we are thinking about cancer? I mean, we think that our patient is not having something like very mild, well, we must be thinking about it if we have unexplained paralysis or loss of energy, if our children has easy bruising or bleeding, if they are suffering for an ongoing pain in any area of the body, if they are limping, if they have unexplained fever or illness that doesn't go away, if we have frequent headaches and after vomiting, as we say in the morning, and if there's any change in the vision quality, any sudden eye or vision changes. Again, we can also consider all these signs for childhood cancer, warning signs. We have already talked about all of them. We have also these like mnemotechniques again, which says child cancer, continued unexplained weight loss, headaches, often with early morning vomiting, increased swelling or persistent pain in bone, joints, back, or legs, lump or mass, especially in the abdomen part, on the neck, chest, pelvis, or even the armpits. If we have the development of excessive bruising, bleeding, rash, as we say petechias, if we have constant recurrent infections, if we have a whitish color behind the pupil, if there's nausea which persists, or vomiting with or without seizures, if we have constant tiredness or noticeable paleness, if there's eye or vision changes which then occur suddenly and persist, and if we have recurrent or persistent fevers of unknown origin. This is just the same, just in a different picture. Okay, doctor, so the goal of this situation about the childhood cancer is to have an early diagnosis so we can start advance the treatment, and therefore we will be looking for a better prognosis for these children. Thank you and see you at the Zoom.